Good evening and welcome to our day two of Patient Safety Week webinar. Thank you for joining us today. Uh, as the rest of the people keep joining in, the topics will be introduced and I'll introduce the speakers. The first topic for today will be Human Factors and Ergonomics in Patient Safety by Mrs. Rekha Biju Varghese and Advancing Patient Safety Strategies and Practices in Improving Communication Between Healthcare Professionals by Mrs. Tilagavati. So let us move right ahead and I'll introduce the first speaker of this evening. Our first speaker is Mrs. Rekha Biju Varghese. She's a registered nurse, nurse supervisor, clinical auditor, quality and patient safety leader. Mrs. Rekha Biju Varghese brings over 25 years of progressive experience in nursing, clinical leadership, and healthcare quality. She holds a MSc degree in MedSurg nursing from Dr. MGR Medical University, Tamil Nadu, and she has a doctorate in management studies. She is currently pursuing a PhD in nursing at Sri Ramachandra Institute of Higher Education and Research. Ma'am has a strong academic and professional portfolio, having presented papers during her postgraduate studies, conducted workshops, and participated in international conferences. She is a recognized speaker in educational programs under Dubai Health Authority and an active member in its nursing executive committee. In her current role at Dubai Health since 2013, Rekha serves as a nurse supervisor and clinical auditor in the quality department. Her responsibilities span incident reviews, morbidity and mortality audits, EMR documentation audits, and risk management. She chairs the Nursing Quality Improvement Forum and coordinates nursing contributions to hospitals, hospital wide quality and accreditation initiatives. Rekha Ma'am is a long standing member of the Dubai Health Nursing Advisory Committee for the EMR project Salama, an information security regulation champion, a JCIA task force member. Her leadership in digital transformation and quality governance reflects her commitment as to human centered system design and safe culture. Her academic excellence includes a gold medal in BSc Nursing from KG College of Nursing, Coimbatore, and a second rank in MSc Nursing from KMCH College of Nursing. She holds certifications in CPHQ and FSQUA and is preparing for the CPPS exam in 2026. We welcome you, ma'am. The platform is yours.
Yeah, thank you, Tanya, for introducing me. Did you know ever 70% of the healthcare errors are linked to human factors and system design? We never thought, I even never thought that 70% healthcare errors happens because of this. Yeah, because of that, the topic is very significant in patient safety. That is human factors and ergonomics in patient safety. So, since most of you have a basic idea, at least one person said never heard about it, we'll just go ahead with a small video which is presented by NHS. So, we'll just watch it and come back. Yeah, here comes Amina.
Human factors is about making it easier to do the right thing. If we make it easier to do the right thing, it also becomes harder for us to do the wrong thing.
I'm sure you have heard the phrase, to err is human. Human error is human nature.
We make little mistakes all the time, just because we are human. At home, they do not often have significant consequences. For instance, you forget to pick up your keys, or you pick up the wrong item in the supermarket because the packaging looks similar.
If you have ever tried to make a cup of tea or coffee in someone else's kitchen, you will understand how being unfamiliar with where things are stored can affect our ability to do a job quickly and easily.
Making a hot drink becomes harder, not because you don't know how to make a drink, but because the layout of the room means you can't find things easily. These same principles apply when we try and do something for our patients.
If you have ever wondered how we can try and prevent things like this happening, then the science of human factors can provide the answers. It can explain why we make mistakes and how we can design the workplace to make it easier to do our jobs.
Human factors describes how we interact with everything in the workplace, the physical environment, with equipment, and with the processes of care that set out how we are supposed to do things at work. Our ability to perform at our best is also affected if we feel tired and hungry.
The culture of the organisation is also important, as this affects how everybody behaves and what happens when a mistake occurs.
Everyone makes trade-offs when faced with the choice of doing something according to the policy as opposed to just getting it done. This is especially the case if work is very busy, there are time pressures, and the system isn't designed to make it easy to do the right thing.
For instance, a patient may be unwell, and the policy says they should have their observations done every hour. However, there are a lot of unwell patients on the ward. All the monitors that the nurse is used to using are currently being used on other patients.
There is another monitor available, but because this is different to the rest, the nurse is unsure how to use it correctly. Rather than try to use a piece of equipment that she is not familiar with, she waits until a different monitor becomes free. In the meantime, the patient deteriorates, and this goes unnoticed.
In this situation, the nurse knew that the patient needed frequent monitoring and observations, but did not provide them. The reason she did not provide them was not because she didn't know what to do, but because the equipment she was asked to use was different to all other equipment. This is an example of where having standardized equipment would have made it easier to do the right thing.
The science of human factors can also help us investigate the way we work, find out why errors occurred, and help design better ways of working.
The aim is not to be critical, but to gain a better understanding of exactly what makes their life difficult and what makes their life easy.
Human factors awareness helps us prevent errors and helps us understand why mistakes occurred. This doesn't just mean when things go wrong, but also near misses as well. However, it only helps us if we are really honest in our investigations and acknowledge the real reasons why things go wrong.
In doing this, we need to look beyond what happened when things go wrong. We need to go all the way back through the system and look at decisions made across the organisation that contributed to the error. This may include decisions made about planning and procurement of equipment.
When investigating errors, human factors can help provide a better explanation of why the error occurred. In the example of the nurse and the monitors, it would be inappropriate to just blame the nurse, because part of the cause of the error was down to equipment design and lack of standardization across the organisation.
We can't do this on our own. It is important that we all play a part in this, all the way from the ward, to the managers, to the hospital board. The more people that understand why human factors is important, the better care we can provide.
The willingness of an organisation to recognise and act on these sorts of contributory problems is a good marker of the organisation's approach to improving safety and quality of care.
Ideally, organisations should have an open and fair culture that encourages reporting of incidents so that everyone can learn from mistakes and near misses.
We can also learn how to improve care by looking at areas where things work well. These areas have often found solutions to problems and already worked out how to do things better.
It is this organisational culture that has an impact on how we treat our colleagues and what happens to staff when mistakes and errors do occur.
If we do this, then we can design the workplace so that it is easier to do the right thing. This makes our jobs easier and reduces the chance of mistakes occurring and causing harm to patients.
Applying a human factors approach to the delivery of healthcare makes it easier to do the right thing and can improve the quality of care that patients receive.
Yeah, with this start, I would, one person have answered, it's about, she never heard about it. So what is all about human factors? It is connecting human capabilities with a good design. So if we have a good design, good workflow, human factors, and ergonomics is into place. So this is what human factors and ergonomics is all about. So every day, as we nurses, we make hundreds of decisions to take care of patients and move across the wards, across the hospital and the work if the environment is designed in such a way which is lighting is proper, equipment is standardized, and the workflow is clear for everybody, it will support not only you, also the patient safety, patient outcomes, and you will be satisfied. So this is what we were talking about. So with a few learning objectives, what is the concept of human factors and ergonomics, and explain the relevance. Let us see what is the relevance in healthcare, and to identify common human factor challenges that nurses face in clinical settings with examples, and how the ergonomic principles can be applied to improve nursing work environments, and also to recognize the different types of human errors with examples and the strategies how we can overcome that, and also the HFE, that is human factor and economic principles, to enhance patient safety and efficiency in clinical processes, such as every process you use, you undergo, that matters a lot. And also to utilize basic tools. I'll introduce a few basic tools which you might be knowing, that which is helpful in having a good HFEs, that is human factor and ergonomic principles in place. So according to a UK short report, it shows from a study of 3,322 error incidents, they identified 28.4% involved gaps in staff knowledge. I will discuss it in detail. And 23.8 involved mismatches between the workload and the staffing, which is a global issue. So that's the reason we nurses will never go out of scope. So 16.8 involved organizational pressures. It could be because staffing, or it could be because lack of system. This is the report says. And many incidents were linked to suboptimal or because of lack of system design. So it could be the human factors design, or the ergonomic principles were not there. So this report again showed that it is many of the things which could have been avoided because of if the system was in place. Also, US Bureau of Labor Statistics in 2018, the report showed 30% of the occupational injuries involving days away from work, absence from work, absenteeism happening because of musculoskeletal disorders. Can you imagine what could be? Because there were no ergonomic principles. Let's see. Healthcare associated and social assistance sector alone reported this much in US. This is reported from India or from other countries. If we take, it will be a huge number. So the statistics from US itself shows this. And also these injuries are commonly due to overexertion, repetitive motion, that is very common among nurses, and awkward postures. Most of the time, we tend to forget the postures which we are doing or we are using while shifting the patient, handling the patients. So that has really contributed to many musculoskeletal disorders. So why these numbers matter for nurses? Is it really matters? Yes, definitely. Because our health, our peace, our well-being, and patient safety. So statistics show that nearly 1 in 3 workplace injuries in healthcare are due to ergonomic failures, because the design is in such a way where we are unable to have a good posture. So most of the times it happens. Also, human factors such as fatigue, long shift, or poor communication. Probably it is a transcultural area where you're working, where the communication fails, If it's the same language, it can be very easy. And also system design flows, as I mentioned earlier, contribute to significant portion of the clinical errors. So we don't want that to happen. There comes the importance of knowing the importance or the significance of having ergonomic principles and human factors in place. Also addressing these through ergonomic redesign and training and staffing improvements can drastically reduce harm to both patients and nurses. So let us see what is this human factors all about. From the video itself, you understood human factors are how people interact with systems, tools, and environment. So how do we interact with the system? With the system, whether it is a well-designed system or it is just purely designed system, or the tools which you are using in the day-to-day life, and the environment, the place where you're working, whether it is friendly to a human. That is what matters. Also, let's see some examples in the nursing practice. Okay. Communication and teamwork challenge, miscommunication. 80% of the errors happens because of the miscommunication. I say something, the team member or the other person perceive in another way, and or I have not given a proper handover. So what can be done? This is the human factor solution. So maybe most of you are working with EMR, that is electronic medical records. Medical records will definitely have some tools in place. Where I am working, we have an Epic system, which is which has this S-bar communication. Even if there is no EMR system in place, you can have this tool in place so that you will not miss anything about the patient. So it says about the situation, why the patient is here, the background, the history of the patient, the assessment, what is it all about, what is this patient has, and also what is the recommendation or the plan of action. So this format will definitely reduce. So I don't know how many of you have been exposed to this S-bar, but it's a very good tool to avoid communication in a teamwork. It can be between the shifts. It can be between different departments or between different healthcare team members. So this is the examples, one main example which can cause issues in patient safety. Also, the second one, as I mentioned earlier, it is a fatigue or workload challenge. As nurses, we have long shifts, high patient loads. It is global issue that increases fatigue and leading to lapses in. You will lose your attention after a while. So what can be done in this scenario is implementing break schedules that, or if as a nurse, if you find it difficult to concentrate, you need to report to your immediate in charge so that it will be taken care. You cannot make a mistake because of your fatigue, because it's all about patient safety. So rotating shift, so shifts changes, or you have a morning shift today, tomorrow you have an afternoon shift, you have time to have a recovery from the previous shift, and also to helps in maintaining the alertness and performance. So a few more examples. Cognitive overload challenge. Nurses, we have often multitask. Patient calling, doctor calling, going for rounds. Patient is sent for CT scan and patient has to come back. Meantime, a cord happens, all this. So monitoring patients, documenting care, responding to emergencies, all these contribute to cognitive overload. Your brain goes out of order or it cannot accommodate what you want to do. So what is the solution? So you have checklists, you have streamlined EMR interface. So what do you mean by streamlined EMR? You must be knowing optimizing or what is friendly to be used, what is important to be documented, not everything. As we know, EMR or electronic patient medical record is a very, very vast ocean, I should say. So according to your need, according to your organization, you need to have a streamline. What is required, what is not required has to be identified. And also checklist will run. You cannot remember what all to be done in a shift. So the checklist will help. Also, it will improve the accuracy of what you are documenting. And another one is a physical ergonomics challenge. While lifting, while shifting, while handling patients, you have a problem. So, what can be the best solution? So, whenever you have to know how the body mechanics or the proper lifting and handling techniques has to. So, you need to train yourself how you have to use the proper body mechanics is the first one. Again comes the use of mechanical layers, or you will have different ways of shifting the patient without causing not much of overload to you, and also adjustable beds. So now all the almost every hospital will have an adjustable bed, which will definitely help us getting any mechanical injuries. Also, error prevention challenge. So you can, there is a chance that when you are busy, there is a chance that you can have a slip. You took a grabbed a wrong medication and you are going to administer to the patient, or there are forgetting a step. So you had to check, for example, you had to check insulin, you had to check the blood sugar of the patient before administering insulin. So, but you just missed, or you have to check the pulse of the patient before giving a beta blocker. So, all these things can be missed. So, what is the solution for this? Barcode scanning system is a wonderful thing which will avoid any errors in with the medication administration. And also double check points. So what is double check points? If the system is alerting you, that is a double check points, protocols or points we can say, and color coded labeling. You have a patient's medicine with high alert medication. So insulin is a high alert medication. So in that high alert sticker is there. So you will be alerted to see that, oh, this is a high alert medication, I should be extremely careful. Or the EMR is designed in such a way that you need to have a double check by another nurse. So this is also a very good way of stopping the error to happen. And also environment design challenges. Cluttered and noisy environments distract nurses and increase the error risk. Why? Because I am in the middle of preparing a medication and somebody is calling. Patient bell is ringing. The doctor came for rounds. All these things will add my distraction more towards other things. So I may make a mistake. So what can be done? In this quiet zones, you need to have a medication room where you will be focused on what you are doing and organized. You should be having an organized workspace where this happens here. IV preparation happens in this room, and at the patient bedside only, I will scan the patient barcode and give the medication. And clear signage also improves the, so from here to here, or any signages which alert you that this is a different medication. You need to be extremely careful. So these are, so in nutshell, if you say about human capabilities, it's all about designing nursing tasks and tools and environments that align with human care. So human, it's always chances of error can happen. But being nurses, we should be extremely careful that human capabilities will be controlled, having a good attention and your capability to focus what you're doing. And also it will reduce the chances of error, leads to patient safety. This is about, let me just reiterate, it's not about fixing people. It's about fixing systems to support people. So we need to have a support in order to provide. So this is all about human factors where the organization is working to fix systems in order to support us. So a few unsafe behaviors also can be a cause. So it's not necessarily that the system is only the problem. Can be a behavior of a person or behavior of team. So let's see a few different behaviors which are there. One is human error, as we mentioned on. It is unintentional, but should not happen. That's the reason we mentioned that system in place to guide me, to avoid distractions, avoid fatigue, and also complex system. So that's the reason when we are oriented well to the system. So any new nurses who are listening to me now, make sure you are getting a thorough orientation. If you're not sure about anything, get help and make sure before going to a patient. Also, you have the right to get oriented when you are boarding to any hospital. Maybe I'm 20 years of experience in one hospital, but I'm moving to another hospital. The system is different, policy is different. So I have the right to ask that please orient me. So nowadays, all the hospitals are well equipped with good way of orienting onboard staff, so that it's not an issue nowadays. So that is the best thing. You need to know the policy, the pace, orient well yourself to the environment, the place, the items which are there, the medications, the equipment you are using, and also the policy which the hospital or the organization has. So there is another called at risk behavior. So let's see an example of, so I'll explain with an example, but behavior that increases risk where risk is not recognized or is mistakenly believed to justify. So let's see how taking shortcuts. So at times I'm very busy, I just deviate or I just ignore what is happening. I don't mind. Skipping hand hygiene due to time pressure. I have too much of pressure from my duty, but never ever taking shortcuts because next day it can be my family member who is getting admitted, and the nurse who is taking care or the healthcare team member who is taking care can do the same mistake and end up in healthcare associated infections. So this is how we have to be extremely careful. It often occurs, the staff believe that it's saving time. No, it's not. It saves time, could be, but it will take away all the protocols, which will end up in errors and safety is hampered. So always skipping hand hygiene due to time pressure is the commonest thing which we see in our career, but it is an at-risk behavior harming the patient. So no, maybe another example, not double checking the medications at peak hours. I'm very busy. I'm going to give medications to few patients. I'm about to go for a patient taken for LSCS. So I have to run. Then I'm not double checking medication. Please ensure that if you are not able to manage that peak hours, seek a help. Communicate to your direct in charge so you will be given a help or a support. And the third type of behavior is reckless behavior. As from the word itself, conscious disregard. I don't mind what happens. I will justify somehow. It's okay. So there are people, when you start working with different nationalities, different types of people, you will see reckless behavior. Administering medication without checking the patient ID. What happens? Ends up in IPSG error or international patient safety error. Instead of giving medication to patient A, I have administered medication to patient B. So that can happen because of the reckless behavior. Also, ignoring safety. I don't mind what protocols in place. So that will definitely lead to serious adverse events in our daily practice, that which we don't want to. And also unprofessional or negative behaviors such as bullying, incivility, the way you you don't mind whoever is working with me, and rude and also harassment in the healthcare. So what is the thing which I'm requesting each one of you, younger generation, most of you would be in the younger generation when compared to me. So report it, not just verbally. It should be reported, document, and it should be through proper channel. So these behaviors harm teamwork, communication, ultimately patient safety. So we are all worried about patient safety. We should never harm a patient consciously or unconsciously. So, linking behavior to a system design. So, as I mentioned, unsafe behaviors because of the poor system design, not bad people again. Bad people can be there, but always because of poor system design. So, ergonomics and human factors can reduce at-risk behavior. There are at-risk behavior. What was at-risk behavior? Because I had to ignore some of the steps in order to finish my work. So it can because of redesigning. So probably they have to look into what is to be built in order to avoid such scenarios. Also, reducing cognitive workload. So the EMR system has reduced much of the all this calculations, double checking, everything will the system will prompt you. So like this, reducing cognitive workload. So when you are on a shift, you find it difficult, you need to report again. Also improving communication tools. As I mentioned, SBAR is a very good tool which you can implement into practice where you will be easily managing the patient handovers. And also foster strong safety culture. We all should be the advocates for patient safety culture. So we can be the first change agent in order to make a safety culture in your workplace. And also provide adequate staffing. That is from the management perspective. But you can always report that I was busy in this shift and I need a solution for this. You can demand for it. And also reinforce accountability. Very important. I am accountable to what I am doing. So always remember. So you have to, from the manager's perspective, I will make sure that the staff are accountable for what they are doing. And from your end, you need to make sure that what I am doing, I'm accountable. So let's just go for a quick pulse check. You can scan this and we'll have a few questions just to see where are we now. Are you all able to see my screen and scan? A few thumbs up. Can I have a response at least? Okay, so let's go to yeah, you can answer. Which of the following is a human factor that can affect patient safety? Is it a hospital policy or a manager or a patient's diagnosis or fatigue? So all of you are agreeing. 3 of you have agreed that it's fatigue. Yes, it's a main human factor which can cause patient related or medication related or any type of error which can happen in the settings. Yeah, we will go to the next slide. Is anyone else is attempting? Okay. So, human factors in patient safety, not about fixing people. It's about fixing systems to support people. Is it true or false? Human factors in patient safety, it's not about fixing people. It's about fixing systems to support people. We have 42 people and only 5 have responded. And one more question before we go to the next. Okay. A nurse skips hand hygiene due to time pressure. What type of behavior is this? Is it human error, at risk behavior, reckless behavior, or system failure? Due to time pressure, the nurse skips. Yeah, it's an at risk behavior. Yep. Okay, only two of you have responded. Okay, three of you have responded. Okay, so let's go back to our presentation. So coming to ergonomics, as you know, it's all about body dynamics. So designing workspaces and tools to fit human capabilities and limitations. Any environment or the workspaces where you're working with, or the tools or the equipments, it's getting designed in order to fit human capabilities. So, what are ergonomic principles in healthcare? So, when applied correctly, these principles reduce physical strain and injury. As I mentioned earlier, it will help you to understand what is the body mechanics I should be following while shifting, handling, or managing our patient to toilets, or what whenever you are managing a patient movement. So also it improves workflow efficiency. If you know how to use the posture correctly, you will improve your efficiency. Suddenly you will shift the patient with no time, with no injury to neither to the patient nor to the nurses. So it will improve the workflow efficiency, and also it will minimize human errors. So because I don't have a problem, I have done my patient shifting, patient handling properly. So there is no chance of making a human error also. Also, it will enhance patient. So patient is shifted, handled well, patient is managed well with a good outcome. Otherwise, falls can happen. So let's see with a few examples. Fitting the task to the worker. So as I mentioned earlier, the equipment, the environment has to be adjusted. It can be a IV pole, which you are struggling to adjust to get the IV bottle. So you are stretching yourself, you are making a physical strain to yourself. Or a bed, you cannot use an old type of bed, normal bed, to keep the patient with pillows and all these things. Instead, you have you can manage the bed by using a new adjusting bed. Also promote neutral postures. So what happens when we are with the patient? So we tend to stretch ourselves, or the stand or the table which you are writing or you are documenting your using an EMR, it is low or very high. Eye strain or your body strains a lot. So this is important to have height adjustable workstations to document. So that is important. You have to request for that. Also, minimize repetitive motions. So using an automated, you must be knowing, all of you. So there are two new things which brings the medications to the bedside. So there is pneumatic system which brings medications from the pharmacy to the workspace. Also, there is something called automated dispensing system. So we have that in the ward itself, you can just mention the patient name so that the medication is dispensed automatically. So these are the good things which have come up, which has really helped the nurses to avoid repetitive motions, going here and there and going, and the medications are late. All this and also reduce force and load. Using the mechanical lifts, as I mentioned earlier, for patient transfers, handling, this will definitely reduce physical effort from our side. Also, enhance environmental conditions. As I mentioned earlier, lighting, noise. So the light is not proper. How do I understand this is the correct medication which I am taking? Noise levels, which is high noise levels, patient calling, treatment is going on, the baby is crying, and the doctor is asking for rounds, all these things. And also the temperature of comfort. You are not comfortable where you are sitting and you will get exhausted. So quiet zones, especially for medication administration and adequate lighting, is very, very important. Also, simplify and standardize the task. As I mentioned earlier, you have a complex workflow and you will not be able to follow that complex workflow. There comes the importance of proper understanding what is this all about, this policy, the protocols. If it is not there, you should be the person to ask for it, to initiate. Every nurse has the power to initiate a change in order to improve the patients. Then you become the patient safety champion. So from 25 years of experience, I'm telling you, we can be the best patient safety advocate and patient safety champion, where you can bring changes in your workplace. So the ergonomic interventions, as I mentioned, the safe patient handling. So you need to have a training and you should equip yourself. Now you don't need a formal training also. You need to ensure that there are plenty of Nurseslab itself. They have mentioned there are plenty of resources available. Make use of it and understand the concepts behind these. How can I ensure my posture, my health, my well-being in a better way, so that I will focus on patient care to avoid all the human errors which can happen, also from the ergonomics. Also, as I mentioned earlier, mechanical lifts, slide sheets, so to slide the patient from bed to structure, and also transfer boards, these can be used. So this needs understanding how I can make use of it. So this is what your initiative comes in. Also, it reduces musculoskeletal injuries and ensures safe patient movement. Workstation design, as I mentioned earlier, poorly designed documentation stations will make you tired. By the end of the day, and next day you are sick leave, your well-being is gone, your loss, you have lack of interest to work. All these things can happen because of height adjustable desk and ergonomic chairs. Also, where you're sitting and doing works, you have to make sure that the posture is well maintained in order to improve your comfort. Not only for that, reduces fatigue and also enhances focus during documentation. And also the medication preparation areas, cluttered and purely lit medication, you have the right to report and to get it organized, layouts where it. So in the beginning, I have shown that video where it shows you may be a very good tea maker. You can make a tea very good in your own kitchen, but when you go to another place where it is, you don't know where the place is. So it does not mean that you are a bad person or you don't know how to make a tea, but because of the disorganized way, an organized layout, adequate lighting and color-coded labeling systems will definitely improve patient safety and also reduces medication errors and improves accuracy. So, and next one is alarm fatigue. So in our institution, we have an alarm fatigue policy, where what happens in an ICU setting, you will keep listening to alarms, unnecessary alarms. So you have to ensure that this alarm is needed for this patient. A chronic patient with a bradycardia, which is acceptable by the MR, the most responsible physician, the treating physician. So in that scenario, you don't need to have that alarm. Because of that alarm, you will be distorted, you will be disturbed, you will be exhausted. So what happens? A critical alarm from another patient or from the same patient will be missed. So in this case, that is also very important to avoid alarm fatigue. Smart alarm systems in place will ensure that you will not be disturbed from these unnecessary alarms. Also, it helps nurses to respond to the critical alarm promptly, improving patient safety. So, in nutshell, about ergonomic principles are it's not just about comfort, as I mentioned, but all about designing safer systems that protect both nurses and patients. From equipment to environment, every ergonomic improvement contributes to better care and fewer errors. That is the goal of every nurse who is attending this. Applying HFE principles in clinical nursing process, which we have already mentioned, medication administration to have not to have interruptions and look-alike, sound-alike medications, and very clear labeling has to be there for each medication. So as I mentioned, barcode scanning, no interruption sounds, and medication storing and labeling. Also, patient handovers, I have mentioned, I'm just recapping everything. That is an incomplete, inconsistent information transfer from one person to another, or one shift to another, or one healthcare team member to another healthcare. So what can be the solutions? Using S-bar, using face-to-face handover instead of over the phone, and also use checklists to ensure critical informations are communicated. Also, documentation, time pressure, complex EMR interfaces, and cognitive. So, too much of thinking to, okay, I have to document these. Instead, if you have a good, not complex EMR system, it will be user friendly. Optimized EMR templates will help, auto refill, and you will have smart text and video to text tools. Also, text tools are also available. Voice to text tools. So you voice out and it will turn to text. Now AI is everywhere, so you will also have these advantages to avoid problems with patient safety. So mobile documentation stations, and there are plenty of devices available. Like a mobile, you can go around and document patients. But again, the training for proper documentation is also very important. So a few tools which I would introduce that in risk management. So you have to identify the risk. That is, one is proactive way of looking at it, and also reactive way of looking at it. Okay, so one is workflow mapping, usability testing. I will explain in the next slide. So observation and task analysis, surveys and feedback tools. Also failure mode effect analysis, and root cause analysis is a reactive way, incident analysis and morbidity mortality workflow. Okay, so first one is a task or the workflow analysis, where you will see what is this workflow, is it user friendly. So that analysis before implementing, that has to be there. Usability testing, anything you are going to implement, it can be a electronic medical record or an equipment, you have to see user friendly or not. So, and another thing is safety walkarounds. Go around when you're free, go and see what are the problems which can happen, and report to the every day when you go to each area, you will find some improvements can be made. So it can be a cluttered medication room or a poor littered room. So that can be audited, and also failure. Any process you want to implement or anything you want to implement, you need to have a failure mode. What can go wrong? So this is a proactive way, or earlier you are looking into it and avoiding what can go wrong. Also, examples and the proactive risk assessment hazard. You identify what can go wrong ahead of time. That is hazard vulnerability analysis, we say. Also, there are risk assessment tools where I will identify these are the risks which can happen in this pediatric unit or in this maternity unit or in the ICU, and you will make sure that these potential errors can be eliminated. Also, preventive interventions. So as I mentioned earlier, implementing many things which is possible by the organization for avoiding such issues in the patient care. Also, monitoring and feedback, very, very important. do audits and give feedback yourself, or the manager can give you feedback. This is a new process which you are going to introduce. Also, I don't want to have a scenario based activity because time is getting up. So very important to have interruptions avoided, cognitive workload, as I mentioned, fatigue and time pressure, and also poor system usability. So this is why we have to have a user testability for anything you want to do. Also, you want to have audits in place and proactive way, not the reactive way. So and also reactive way after an incident happens. We don't want that to happen. But if an incident happens, you have to do a root cause. What is the problem? Where is the exact root cause of this problem? You will identify. Also, report the incident in the safety reporting system. That is very, very, don't be afraid. So you delay, patient may go out of your control, or anything can go out of control. So better to report in place, and also discuss it in the morbidity and mortality review. This is very important, reporting and discussing and making a new workflow. The key takeaways for today's session are: human factors do matter to prevent errors, and ergonomic protects nurses and patients. Better design is very important, and proactive tools prevent harm. I said already that proactive way of doing systems will help us, not the reactive way, but we have to have the reactive way to help us learn and to improve. And nurses, be proud that we are the central for patient safety. These are my references. And to err is human, but to design for safety is very essential. Thank you so much, the organizers, and your for having me. And also,
Thank you, ma'am. That was definitely a very interactive session and in depth explanation of this topic. I hope so many people have found it very helpful. And thank you once again. And we will move on to our next speaker for this evening. I'd like to introduce Mrs. Tilagavati Vasudevan. Ma'am is a head of nursing operations, infection control specialist at Dr. Mehta's multi specialty hospitals in Chennai. Ma'am is an experienced and dynamic nurse leader with 19 years in nursing, infection control, and quality management, currently serving as a head of nursing operations in Mehta's hospital. She has proven expertise in patient care, staff monitoring, hospital infection control, and healthcare innovations. Ma'am has completed a BSc nursing from Dr. MGR Medical University and her MSc from Rajiv Gandhi University. Her achievements include receiving the Leadership Impact Award in 2025 and a Trendsetter Award from the ANEI in 2024. We welcome you, ma'am. The stage is yours now.
Thank you, Tanya. Hi, everyone. Today we are going to talk about communication in healthcare. We all see what strategies and techniques we can use to make sure patient care is always safe. As we all know, nursing is like the center of the healthcare universe. Nurses connect with everyone: doctors, lab staff, radiology, billing, and many other departments, along with taking care of patients and attendant. That is why good communication skills are so important for us. Communication doesn't just mean language, it is an art. It is about how we handle a situation and how clearly the message reaches the other person. Nearly 90% of clinical errors are linked directly or indirectly to communication failures. Out of this, about 80% of medication errors, and within that, around 60% are caused by nurses. The important points is that nearly 70% of these nursing errors happen mainly because of poor communication. Nearly 90% of clinical errors are directly or indirectly linked to communication skills. In that 90%, 80% of errors are medication errors. In that 80% of errors, 60% is caused by our nurses. In that 60%, 70% is related to communication. The World Health Organization and the Joint Commission both highlight that communication breakdowns are one of the top reason for serious incidents in the hospitals. A study in BMJ quality and safety found that 80 to 90 percentage of adverse outcomes in clinical settings stem from poor handovers, incomplete documentation, ambiguous verbal instructions, and hierarchical silencing of team members. When we look at most clinical errors, whether nursing errors or many other actually linked to communication failures. Poor handovers, for example, between doctors to doctor, nurse to nurse, or doctor to nurse. If important details are missed, errors can happen. Incomplete documentations. Suppose a nurse gives a drug but forgot to document in the drug chart. Another nurse may think the medicine was not given and administer a second dose. What happened? It will lead to overdose. That is why either drug must be given only by the assigned staff or the complete case sheet must be handed over to the nurse properly. Unfortunately, in some hospitals, proper assignments are not followed, which increases the risk. Still, in many of the hospitals, functional assignments are happening, so that should be avoided to avoid many of the errors. Next one is ambiguous verbal or written instructions. These are unclear instructions. Ambiguous verbal instruction is unclear instructions. Nowadays, many hospitals don't allow verbal orders except during emergencies like code blue. But in some hospitals, it's still happening. Example, in one of the hospital, one of the doctor prescribed injection potassium chloride IV, but didn't mention the dilution in the ICU unit. So the nurse gave it directly as a bolus injection. She didn't dilute it. Actually, it should be diluted before administering. It should not be administered concentrated. The patient went to the cardiac arrest and died. So these are all the consequences may happen because of this ambiguous verbal or written instructions. Then hierarchical silencing. That's very, very common in India among nurses. Sometimes nurses know the order is wrong, but keep quiet out of fear of questioning the doctor or the senior. This can cause serious harm. Here, another example, a patient on aspirin was scheduled for elective surgical patients. The nurse know aspirin should be stopped before 48 hours of surgery to prevent complications like bleeding. But because of fear, the junior nurse didn't inform to the doctor or the surgical team. The doctor also forgot, the surgeon also forgot who is treating the patient, and the surgery was fixed. Luckily, in the OT, another nurse spoken up and informed the surgeon. The surgery was postponed and the patient was saved from the serious bleeding complications. The junior nurse, because of fear, she didn't escalate. But luckily, the assertive senior nurse in the OT escalated. So the big complication is prevented and patient was saved. So we can see how communication plays a very major role in patient safety. Here is a picture. It is a funny picture. This cartoon is a funny but powerful reminder of how important communication is in healthcare. Here the surgeon are supposed to live together, but one person didn't wait for the count. The result is confusion and maybe even harm. Patient fell down from the OT table. This shows that without clear coordination, communication, even small tasks can go wrong in a team. In the hospital setting, poor communication can lead to errors, patient injuries, and even life-threatening situations. That is why we always stress clear instructions, repeating orders if needed, and confirming before taking actions. Why communication matters in healthcare? Anyone can say why communication is a matter in healthcare? Just we are transferring the information, just feeling, or it may be from some of the form of words or something else. So why does communication matters in healthcare? First, error prevention, mainly in healthcare to prevent errors. Clear communication help us avoid medical errors and prevent dangerous misinterpretation of health information, like critical informations. Secondly, trust building. A good communication builds trust and rapport with patients and their families through open and transparent dialogues. If we go and talk to the patients, if we go and talk to the attendant, we explain each and every procedures, patient definitely will build trust on us. Otherwise, if you don't talk, if you don't open your mouth, you just go mum and administer medication. If you don't explain to the patients before doing any procedure, definitely the patient and attendant won't believe us. So it is very, very important. Third, team collaboration. It strengthens teamwork across disciplines and ensures smooth care transitions. And finally, job satisfaction. To get job satisfaction, definitely communication will help. Effective communication improves job satisfaction and reduces burnout among nursing staff. Nursing staff should talk each other. They should express their feelings. What are the difficulties they have? They have to talk to their in charges. They have to talk to their higher ups. If they have any difficulties, definitely they have to come up. If they have any suggestions, they have to share. To get a job satisfaction, there are so many ideas and so many things we can do it for the nurses. As a nurse leaders, we can do so many things to the buddies and nurses. Junior nurses also can contribute many of the things to their team. Like, we can have a potluck, we can go out, we can have some fun activities after the duty hours. Types of communication. There are four types of communication. Everyone knows: verbal communication, non-verbal communication, written communication, and electronic digital communication. First one is verbal communication. It is face to face conversation, daily, whatever we are doing. The team huddles or word rounds. If we have a team meeting, definitely we have to talk. So in that time, verbal communication helps. During ward rounds, definitely we have to talk. Then phone calls. Through phone calls, we cannot. In that phone calls, we cannot use non-verbal communication or other communications. Definitely, we have to communicate something. It should be clear, concise. Then overhead announcements. Example, code blue or code red or whatever codes, we have to clearly communicate. This verbal communication best for urgent updates. If anything to be updated urgently, we cannot wait for mail confirmation or WhatsApp messages. Definitely we have to call and confirm. Then clarifications. If any clarifications, definitely verbal communication helps. Then quick decisions. During emergencies, definitely we have to use a verbal communication. Risk. Prone to misinterpretation if rushed or incomplete. If the communication is rushed, too fast, it is not clear, concise, or if it is in another language, it is not understandable, definitely it will be at risk. Second one is non-verbal communication. Non-verbal communication involved in body language. Body language is one of the most important thing in communication. Always in our nursing profession, our heads and our faculty, our teachers used to say, always we have to stand straight. Our body position play a major role in the communication. If you lean, if you don't show any interest in your body language, definitely our patients or any of the healthcare workers, doctors or colleagues, they don't trust us. So body language plays a major role. Then eye contact. Always we should have a proper eye contact, eye to eye contact. Clearly, in all human beings, if we have a proper eye contact, the opposite person will believe you. If you don't show any eye contact, they'll think that we are not having any interest on them. So, have eye contact. Then facial expression. It is also very, very important. Example, when we are any patient delivered, they given a birth, definitely we should have a broad smile in our face. Even we are in some stress, burnout, or whatever the situation is, we should have a broad smile and we have to go and communicate to the patient attendant that, madam, your daughter or daughter-in-law or whoever delivered a baby child, male or female, whatever it may be. We should have a broad smile in our face. But in any difficult situations, like if any dead declared or something, patient is sick, that time we should not have smile in our face. Definitely, we should have a long face, sad face. We should be calm, quiet. Our tone should be changed. So all these facial expression plays a major role in the communication. Gesture should be good. Then best for this non-verbal communication, best for building trust. If someone should develop trust, definitely our non-verbal communication helps. Then showing empathy, reinforcing verbal messages. Risk may contradict spoken words if not aligned. If we have very sad face and communicate something happy news to the patient attendant or to any of the healthcare worker, they don't believe you. They'll think that you're not interested. You didn't know much about the scenario. You didn't have any content, so they don't believe you. If you want to use a non-verbal communication, it should be aligned with the word. If someone says something, you should nod your head. If you don't nod your head, they'll think that you're not accepting something what their opposite party is telling. So there are some risks and there are some benefits in the non-verbal communication and written communication. First is verbal communication, second one is non-verbal communication, third one is written communication. Patient charts and medical records. This is the very, very important part in our nursing profession. Patient charts and medical records, incident reports, all these should be, this written communication should be very, very clear, concise. Everything should be documented very clearly. If you are handwritten, it should be very clear. If you are putting it in the HIMS, the grammatical, there should not be any grammatical mistake. It should be very clear and concise. Then shift handover notes, internal memos or guidelines. For all these, we are using the written communication in our nursing. It is best for permanent records, legal documentation, and protocol sharing. Risk in this is can be misread or overlooked if unclear or incomplete. It should be always complete. If it is incomplete, there is no use. It won't talk legally. It is a legal documentation. Whatever we are writing, we are documenting is related to legal. It will be related to legal. If any legal issues, definitely our notes will speak. So it should be very clear and concise. Finally, electronic and digital communication. Electronic health records. Nowadays, in many of the hospitals, we are using electronic health records. Then secure messaging apps like Tiger Connect, WhatsApp for business, if compliant. Then we are using emails to communicate each other to get approval and many other things. Then patient portal. Nowadays, in many of the hospital has patient portal. They can register their visits in that. They can book appointments. They can see their reports in that. They can do many other things. Then telemedicine platforms is available. Previously, after post-operative period or any patients want to consult the doctor, they have to visit the doctor. But nowadays, this telemedicine is helping. They can consult the doctor through telemedicine platform. Best for centralized access, asynchronous updates, team collaboration across departments. Risk is delayed responses because of poor internet connection or they might be in some other work. So delayed responses can be occur because of this electronic and digital communication. Then tech literacy issues. In the remote areas, there won't be proper Wi-Fi connections or they are not aware of the systems. So it might be a risk and over reliances. Sometimes we may be over reliance to the digital platform. In that time, we can't access to the data or we'll miss some critical situations. It may happen. So there are four types of communication: verbal, non-verbal, written, electronic, and digital communication. Foundations of effective healthcare communication. Good communication is the foundation of safe and effective healthcare. There are four key qualities we must follow. Communication should be accurate, complete, clear, and timely. For example, if a nurse is reporting patient blood sugar level, she should give the accurate value, mention whether insulin was given to make it complete, explain in clear words, and pass the information to the doctor without delay. That means timely. In addition, we should also remember the three C's of communication. It should be correct, clear, and concise. For example, during handover, instead of saying the patient's sugar problem in the morning, patient had increased sugar in the morning, it is better to say patient fasting blood sugar was 220 mg per TL at 7 a.m. Insulin 6 units was given as prescribed by the doctor. This was the message is correct, clear, and concise, and avoid confusions. Components of communication. This is the components of communication. Whatever we talk, in whatever language we talk, a body language is contributing 55%. A body language, whatever we converse, what in that communication, body language is contributing highest, it is 55 percentage. Voice is 38 percentage. Voice or tone is contributing 38 percentage. Words are contributing only 7 percentage. So majority is our body language. So should always maintain a proper body language whenever we communicate to someone. Communication barriers, there are two types of barriers, internal barriers and external barriers. Now let's look at the internal barriers that can affect communication. The first one is disinterest. Sometimes nurses may have personal issues or simply lack of interest in a particular topic or specialty. This can reduce effective communication. Example, pediatric nurse can be posted in the adult ward or in the some other ward. So they don't have any interest to talk to others. Next is fatigue. When there are too many patients and improper nurse patient ratio, a lot of documentation, or when we are dealing with sick and demanding patients, demanding doctors, or even non nursing activities, it leads to tiredness and affects how we communicate. Another barrier is poor listening skills. If we are not fully attentive, we may miss important details from the patients or colleagues. Past experiences with patients can also create bias. For example, if patient was previously uncooperative, the nurse might carry that impression forward and not communicate effectively. They don't go to the patient at all. They just ignore the patient. If they go, definitely they'll get some feedback from the patient attendant. So they'll avoid visiting the patient only. Past experience, then home or work problems. Personal stress or issues at the workplace may distract us and become a barrier. Finally, time constraints. When we are overloaded with sick patients or when the proper nurse patient ratio is not provided, we may feel rushed and unable to spend enough time with the patients and others to communicate properly. So, all these internal factors can create major communication gaps in nursing practices. External barriers. External barriers are language, gender, cultural, interpersonal, and environmental. These are the five external barriers. Now let's look at the external barriers. The first one is language. When the patient and the nurse don't share the same language, it creates confusion and delay in care. Second is gender. Sometimes gender differences may make a patient uncomfortable and that can affect open communication. But we should not at all think about the gender. Patients are patients, staff are staff, nurses are nurses. We should not show any disinterest. We have to explain to the patient properly. Or else we can assign the male staff to the male patients if they are not comfortable. Then next we have cultural barriers. Patients may have different cultural beliefs, practices, or traditions that influence how they express themselves or accept treatment. Another one is interpersonal barriers. This happens when there is a lack of trust, respect, or understanding between the nurse and the patients. And lastly, environmental barriers. Environmental barriers like noise, or overcrowding, lack of privacy in general ward or some open wards, or interruptions in the hospital can make communication very difficult. So there are the main external factors that can block clear and effective communication in the healthcare setting. Then breaking down communication barriers. There are five things: workload pressure, cultural language gaps, complex medical jargons, lack of structure, and hierarchical challenges. The first one is workload pressures. When nurses have heavy patient assignments and strict time limits, they often don't get enough time for clear and complete communication. We'll do everything in a hurry manner. We just will have in our mind that we have only 5 minutes of time, we have to complete everything. We don't show much interest to the patient to communicate. Then second barrier is cultural and language gaps. Differences in language and culture can lead to misunderstanding between staff and the patients, but it is very rare. But sometimes it may happen. The third barrier is complex medical jargons. Sometimes we use too many technical terms. Example, I'm going to check vital signs. I'm going to do. You are a hypertensive patient. hypoglycemia happened to you. So we should not use all those jargons. If we use jargons, and again it will be a communication failure. This confuses patients and create gaps in understanding. They don't understand anything. They'll think that they are saying something. They don't understand the current situation. Next, we have lack of structure. If there are no standard communication tools or systems, information becomes inconsistent and important details may be missed. Finally, there are hierarchical challenges. In healthcare, traditional hierarchies sometimes make junior staff hesitant to speak up. Already we saw and ask questions, and sometimes they say they don't know how to say no. So these are the key barriers we need to be aware of. How to overcome communication barriers? So how we can overcome these communication barriers? Deliver crystal clear messages. Whatever you talk, deliver a crystal clear message to the recipient, then receiver. Then deliver message skillfully. Always talk confidently. Always talk confidently. Whatever message you deliver, please make sure whether it is right. Then focus on the receiver. Always concentrate on the receiver when you are talking. Don't see somewhere and communicate to the receiver. Then use multiple channels to communicate instead of relying only one channel. Don't wait for the doctor to come to tell the patient reports. Don't wait for the doctor to go and communicate something to the patients. Always use multiple channels. Then ensure appropriate feedback. Always ensure appropriate feedback. After you talk, you just wait and get a feedback from the opposite person. Then be aware of your own state of mind, emotions, and attitude. If you're not in a calm state, if you think you're not in a proper state to deliver a care, you just go and inform to your senior nurse or in charge that you're not in a calm state to work in that period or to go and deliver a care to the particular patient. And standardized communication tools in healthcare. This is the very, very important part in communication in healthcare, technology and strategy. First one is check back, closed loop communication, yes bar, situation, background, assessment, recommendation, used in handover communication. Then IPASS is also used in handover communication. Then AIDIT, a framework for patient-centered communication, writing procedures and scripts. Then SOAP note format, subjective, objective assessment plan. It is used for written communication. Then SPIKE protocol, already in last session we saw setting, perception, invitation, knowledge, emotion, strategy, summary, and it is used for breaking bad news. Let's see one by one. First one is check back, closed loop communication. This is a very important tool. Use confirming instructions or verbal orders to ensure accuracy, like code blue. Example, doctor in code blue. Example, doctor give 1 mg adrenaline IV. Doctor give instruction to give 1 mg adrenaline IV. Nurse immediately have to confirm like 1 mg adrenaline IV confirmed. We have to say 1 mg adrenaline IV confirmed. It prevents miscommunication and critical in emergencies and medication order. Communication during handover. First is introduction. Introduction, identify yourself. Yes, situation, clinical need, symptoms. B, background, diagnosis, comorbidity, medications and allergies. A, assessment, current condition, observations. Or for recommendation, be clear with what you're requesting. Here is one example of ISBAR, identity. Hello, Dr. Patel. This is Sarah, staff nurse on Ward 5A. I'm calling about Mr. Rajiv Sharma, a 68-year-old patient in bed 12. His MR number is 456789. So always identify the patient with name and UHID number. Then situation. I am concerned about his oxygen saturation has dropped suddenly to 84% on room air. He is short of breath and becoming increasingly drowsy. This is the situation of the patient. Then B, background. He was admitted 2 days ago with community acquired pneumonia and has been on IV antibiotics. Until now, his vitals were stable and he was on 2 liter oxygen via nasal cannula. This is the background of the patient. First, we are identifying with name and MR number. Then we are telling the current situation of the patients. Then we are quoting the background. Then assessment. A nurse is assessing. On assessment, his respiratory rate is 32, BP is 98 per 60 mm of Hg, heart rate is 112. He is using accessory muscle to breathe and auscultation decreased breath sounds on the right side. So, what it is the recommendation from our nurses. I recommend that you assess us immediately. I also suggest increasing his oxygen and possibly ordering a repeat chest X-ray and ABG to confirm any lung collapse or any other problems. Should I initiate high flow oxygen in the meantime? This should be the recommendation from the nurse side. So ISPAR is the main communication tool for our nurses during the handing and taking over. Next is AIDIT, a framework for patient-centered communication. AIDIT is a structured communication tool used by healthcare professionals to enhance interactions with patients, families, and even colleagues. It stands for A. Acknowledge. Make the person feel welcome and respected. I introduce, always introduce, share your name. I'm so and so, which we should share your name. Some of the nurses, it is a rare scenario. When patient asks what is your name, they'll say, why you should know my name? We can't say like that. During the bundles, that is why we introduce a bundle. We have a bundle. Good morning, good evening, good night bundle. During that time, we always should introduce ourselves. Example, if morning and afternoon duty staff introducing themselves during the bundle, the afternoon duty staff must introduce the morning duty staff. She is Miss So and so. I am going to relieve. She'll be taking care of you till this time. Then the afternoon duty staff should again tell her name to the patient, introduce herself to the patient, and she should explain what and all she is going to do for the next 8 hours or 6 hours. The bundles introduction is very, very important, and what their role and credentials. Then duration, explain how long procedures, weights, or care will take. Example, duration. If we are sending the patient for CT scan or something, we have to tell it will take 1 hour time, half an hour time, whatever time it will take, we have to clearly explain to them. Then describe what will happen and why, set expectations, then thank you. Always we have to greet the patient and we have to thank the patient, thank the healthcare workers. Edit example, first acknowledge, good morning Mr. Kumar, how are you feeling today? We are greeting the patient. Then introduce, I am Priya, your nurse, I will be checking your vitals now. Then duration, it will just take about 5 minutes. We have to tell the duration. For checking the vital signs, it will take just about 5 minutes. Then explain, always explain. I'll check your temperature, blood pressure, the BP, pulse, and oxygen level. We should not use any medical jargons. This will help us monitor your health. Then say thank you. Thank you for your cooperation, Mr. Kumar. Please let me know if you feel uncomfortable. So always we have to use edit in a simple format. Next one is so. First visa is bar. Second visa edit. Now it is so. So is note format. It is a note format. Subjective, objective, assessment and plan. What we nurses are used in written communication for standardized clinical documentation. It includes subjective, what patient says, then objective, what we observe in the patient, then assessment, what we assess, then plan of care based on the assessment. It ensures comprehensive and organized notes and common across outpatients and inpatient settings. Example of so, yes, patient reports occasional headaches and dizziness over the past week, missed 2 doses of medication due to travel. Objective data, the BP 158 by 94 mm of Hg, heart rate is 84 beats per minute, a weight is 74 kg, no signs of edema or distress, labs from last visit within normal limits. A. Uncontrolled hypertension likely due to non-adherence to medication. Patient didn't take medication properly. Last 2 days, patient missed the medications. B. Plan of care. The reinforced medication adherence. We just have to reinforce the patient to take the medications properly. Then continue amlodipine 5 mg daily. Schedule BP recheck in 1 week and educate on home BP monitoring. This is the example of So, next is Spikes protocol. It is mainly used to break the bad news. The Spike protocol is a powerful patient consent communication tool used by healthcare professionals to break bad news in a structured, compassionate, and effective way. This is especially relevant in oncology, palliative care, critical care, and other emotionally sensitive situations. The Spike protocol is a six-step strategy designed to guide clinicians through the challenging task of delivering serious or life-alerting informations. Clearly, we said that it is used in breaking the bad news. Spike protocol. Already in last session, Madam explained, so I'm not going to explain this. Let us see the example of spike. Yes, setting. Let's sit here where it is quiet, so we can talk comfortably. Let's sit here where it is quiet, so we can talk comfortably. Sitting. P is perception. Can you share with me what you know about your father's condition so far? Just we are collecting the history. Perception. Can you share with me what you know about your father condition so far? Then I invitation. Would you like me to explain the test results in detail or just give you the main points? Then knowledge. The test shows that the infection has become very serious and he need ICU care. Since patient in ward, patient need high-end care. E. Empathy. Empathy, I can see this is very difficult news. It is normal to feel upset. We are here to support you. This is empathy we are showing against the patient attendant. Yes, strategy and summary. The doctor will start stronger antibiotics and we will monitor him closely. We will keep you updated regularly. This is the example of spikes. Let us see a few challenging scenarios. Whenever you feel that is a challenging scenario, look for the signs. Learn to recognize early signs of anxiety and fear. Tightened jaw. Patient, attendant, whoever, their face will become tight. So tightened jaw you can feel. Nervous or fidgetive, they might feel very nervous. Then clenched fist, they always have their hands like this, and sarcastic smile, they smile like that sarcastic smile and might be very rich. Then significant challenges in behavior. First, we have to identify whether the patient, attender, or whoever we are handling, we have to see all these symptoms. If they have, definitely it will be a challenging scenario. Strategies to diffuse a challenging situation. While dealing with a challenging situation, you should adapt the following strategies. Remain calm. Just be calm. Engage in conversation if needed. Otherwise, be quiet. Be empathetic. If you can, console the patient or attendant. Or you can, if you handle something, be empathetic. Then avoid arguing. Don't argue. Don't retaliate. Be calm, quiet. Then set boundaries. Just set boundaries. You have to convey only this. You should not talk more than this. You should not you should not convey some reports to the patient. You should not convey some situations to the patient or attendant. So set boundaries, then shake it off. After the scenario ends, just leave it. Don't always keep it in your mind, just leave it. In conclusion, key takeaway, effective communication is essential for safe and high quality patient care. 90% of clinical errors are linked to communication failures. Standardized tools like ISBAR, AGIT, Spikes improve clarity and consistency. Closed loop communication and structured hands off reduced misunderstandings, and creating a culture of openness and collaboration is key to preventing errors. That's it. Thank you for patient listening. If any doubt, you can ask.
Thank you, ma'am, for your interactive session.